So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease-free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome. Thank you for joining today's discussion with our student team at Assuaged. Today we will be covering types of hepatitis, exploring the forms, causes, symptoms, and treatments. We'd like to thank our student speakers for contributing to this PowerPoint presentation, as well as joining as a speaker and contributor. Alyzabeth Ruffin, Tamira Sims, Jaime Persaud-Thomas, Pauline Ongolea, Dr. Sana Mian, featured board members. Normally we have Dumisani here with us. He's not here today, but we're, of course, giving him credit for being here with us in spirit because he does such an amazing job running the most of our PowerPoint presentations, and he is our director of media. Myself, Cynthia Cherise Murphy, I'm the vice president, and Crystal Rylowicz is our executive director of Practicums. We'd also like to thank our student slide contributors, Crystal Rylowicz, Tamira Sims, Jaime Persaud-Thomas, Dr. Sana Mian, and Karizza Cordero. This is a slide that we dedicate to Dumisani, our director of media. He also has his own nonprofit, LoveHealsTheWorld.club. He is a celebrity photographer, videographer, and dedicates a great amount of time to our student team. So we want to honor him for supporting our team, and we encourage you to go check out his mission and get a look at all the amazing glitz and glam photos that he takes on the red carpet. We would like to thank Restream for sponsoring our student team. We could not do this without you. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it the most. Thank you, Restream. Today we have an agenda. So our introduction is going to consist of the definition, importance, and understanding of various types of hepatitis, overview of liver function, transmission and symptoms, overview of the associated risk factors for hepatitis A, B, C, D, and E, prevention and treatment, vaccination, hygiene, and safe practices, antiviral medications and public health strategies, Our conclusion and discussion will be the fourth section, summary of key points, importance of prevention, awareness, screening, and global initiatives. So now I'd like to welcome Crystal Rylowicz to take over the speaking portion of the overview of hepatitis.
The overview of hepatitis. Hepatitis is a liver inflammation frequently caused by a virus. It comes in several forms, the most prevalent of which are hepatitis A, B, C, D, and E. Every kind is caused by a distinct virus, which differs in terms of symptoms, potential long-term effects, and means of transmission. The Centers for Disease Control and Prevention 2024. The importance of understanding the different types of hepatitis. Comprehending the distinct varieties of hepatitis is essential for efficient prevention, precise diagnosis, and customized therapy. It lowers the risk of chronic liver disorders such as cancer and cirrhosis, facilitates focused public health interventions, and provides information for improved health policies and budget allocation. This information enhances results and aids in hepatitis outbreaks containment. Mahata and Redivari, 2024. What is hepatitis? According to the Centers for Disease Control and Prevention 2024, hepatitis is an inflammatory liver condition usually brought on by viral infections. However, it can also be brought on by alcoholism, toxins, certain drugs, and autoimmune disorders. The image above illustrates the progression of liver health from normal to various stages of liver damage. Overview of liver function. The metabolism is where the liver metabolizes lipids, proteins, and carbohydrates when necessary. It can also convert stored glycogen back into glucose by converting extra glucose to glycogen. Detoxification. The liver eliminates a range of metabolites, medications, and pollutants. It purges toxic chemicals from blood through processing. Production of bile. The liver secretes bile, which is necessary for the small intestine to properly break down and absorb fats and fat-soluble vitamins. Storage. The liver retains iron and copper, as well as vitamins A, D, E, K, and B12, and releases these substances when needed. Synthesis. The liver produces several vital proteins, including clotting factors, albumin, and certain hormones. Immune function. Kupffer cells, a component of the immune system, are found in the liver and aid in the elimination of bacteria and other pathogens from the blood. This is reported by the National Institute of Diabetes and Digestive and Kidney Diseases in 2017. The various types of hepatitis include hepatitis A virus, known as HAV. It is usually contracted by drinking or eating tainted food or water. Frequently, it is severe and self-limiting. HBV, or hepatitis B virus, spreads by contact with contagious bodily fluids, including semen or blood. It may be persistent or acute. HCV, or hepatitis C virus, is mostly transmitted by blood transfusions. It frequently turns chronic and can cause a significant harm to the liver. Hepatitis D virus, or HDV, because it needs the hepatitis B virus to multiply, it can only develop in people who have already contracted hepatitis B. Hepatitis E virus, HEV, usually is contracted by drinking water tainted with excrement. Usually it is severe and self-limiting. For your information purposes, this information was all obtained from the Centers for Disease Control and Prevention in 2024.
Hepatitis A, according to the Cleveland Clinic 2023, transmission fecal-oral route. Hepatitis A spreads through ingesting fecal matter, often from close personal contact with an infected individual or consuming contaminated food or water. Symptoms. Infected individuals, including adults and children older than 6, may experience stomach pain, nausea, vomiting, diarrhea, fever, joint pain, itchy skin, jaundice, weakness, and fatigue. The virus present in their blood and feces. Risk factors. Higher risk includes individuals with compromised immune systems, those living in unhygienic conditions, people who inject drugs, the homeless, individuals with HIV, and those engaging in sexual activity with an infected person. Hepatitis A prevention and treatment. Vaccination. Overview. Highly effective, recommended for children starting at 1 year and at-risk adults. Schedule. 2 doses for children, first at 1 year, second 6 to 12 months later, 1 dose for adults with a follow-up if needed. Effectiveness. Long-term protection up to 20 plus years, adequate within 2 weeks of exposure. Hygiene and sanitation. Hand hygiene, regular hand washing with soap and water. Food/water safety. Avoid contaminated food/water. Practice proper food handling. Sanitation. Clean surface and utensils. Use safe water sources. Treatment options. Management. Typical self-limiting treatment is symptomatic. Supportive care. Rest, hydration, and over-the-counter medication for symptoms. Monitoring, regular checkups to monitor liver functions. Antiviral treatment not available for hepatitis A. Information obtained from Cleveland Clinic 2023. Hepatitis B. Transmission, blood and bodily fluids, symptoms, and risk factors. According to Kahn 2012, hepatitis B is transmitted through contact with bodily fluids from an infected person, which can occur during childbirth, sexual activity, contact with open wounds, or by sharing syringes, needles, razors, or toothbrushes. Symptoms may include fever, joint pain, nausea, weakness, abdominal pain, swelling of limbs, and abdominal jaundice, dark urine, clay-colored stool, and fatigue. Although not everyone shows symptoms, risk factors include unprotected sex, needle sharing, exposure to blood, mother-to-child transmission, healthcare worker, household contact, travel to high-risk regions, multiple sex partners, HIV infection, and incarceration. Hepatitis B typical symptoms of infections: fever, loss of appetite, nausea and vomiting, abdominal pain, weakness and fatigue, joint pain. Hepatitis B symptoms: nausea, vomiting, loss of appetite, pain in abdominal, jaundice, dark urine, tiredness, weakness, and joint pain. These are the common symptoms of hepatitis B. Hepatitis B prevention and treatment. Vaccination. A vaccination course consists of 2, 3, or 4 doses. The first dose should be given to infants at birth, and they should typically finish the series between the ages of 6 and 18 months. Center for Disease Control and Prevention, 2023. Safe practice. Use condoms for safe sex, avoid sharing needles, and ensure sterile practice. In healthcare settings, follow protocols for gloves, needles, disposal, and equipment sterilization. For high-risk environments, get vaccination and get regular tests. Treatment options. Treatment options for hepatitis B often involve antiviral medication like entecavir. Getting plenty of rest, wearing loose clothing, and using over-the-counter medication as needed are also recommended. Kahn 2015. Hepatitis C. Hepatitis C transmission, blood-to-blood contact, symptoms and risk factors. Hepatitis C primarily spreads through contact with infected blood, the most common transmission routes including injecting drugs. 66% of new cases, mother-to-child transmission during birth, unregulated tattoos or piercing, sharing personal items contaminated with blood, and sexual contact with an infected partner. United States Department of Human and Health Service 2024. Most people with hepatitis C do not show symptoms. However, common ones include fever, fatigue, nausea, abdominal pain, swelling, jaundice, dark urine, clay-colored stool, and itching. World Health Organization 2024. Risk factors include being a healthcare worker exposed to infected blood using illicit drugs, having HIV, receiving unsterile tattoos or piercings, past blood transfusion before 1992, long-term hemodialysis, being born to an infected mother, or incarceration. Qatar 2022. The images on the side, mode of transmission of HCV. Non-sterile tattooing needles, contaminated dialysis equipment, contaminated vaccination equipment, non-sterile dental practice, contaminated drug needles, non-sterile body piercing equipment. According to the medicalinfo.org 2020, the image on the left outlines the mode of transmission of hepatitis C. Symptoms of hepatitis C, according to healthcareontime.org 2020, are liver pain, temperature, jaundice, itching, nausea, fatigue, and dark urine.
Hepatitis C prevention and treatment. No vaccine available. There is no vaccine due to its high genetic diversity, and multiple strains complicate vaccine development. Unlike hepatitis B, which has fewer strains, hepatitis C's frequent mutations and ineffective immune response pose challenges. Research is currently focused on developing effective treatments rather than vaccines. Karizza 2023. Preventive measures. Avoid sharing needles or syringes, and always use sterile equipment. Practice safe sex with condoms and limit partners. Use licensed professionals with sterile, single-use equipment for piercings and tattoos. Do not share personal items that could be contaminated with blood, like razors and toothbrushes. Centers for Disease Control and Prevention, 2024. Treatment options. Direct-acting antivirals, or DAAs, cure more than 95% people within 8 to 12 weeks. Liver transplant, necessary in severe cases. Lifestyle changes. Avoid alcohol, exercise often, and maintain a healthy diet. World Health Organization, 2024. Hepatitis D. According to Patel et al. 2019 and Urban et al. 2021. Transmission, blood and bodily. Through direct contact with blood and bodily fluids, unprotected sex, sharing needles, and rarely from a mother to a child during childbirth. Symptoms include abdominal pain, fever, joint pain, loss of appetite, nausea, dark urine, clay-colored stools, jaundice, and fatigue. Risk factors: co-infection with hepatitis B or HIV, unprotected sex with an infected person, needle sharing, injecting drugs, being born to an infected mother, having multiple sex partners, undergoing hemodialysis, and being a man who has sex with men. Hepatitis D prevention and treatment. Prevention: HBV vaccine, hepatitis B vaccine. The primary method of preventing hepatitis D infection is through vaccination against hepatitis B, HBV. Because Hep D, HDV, requires HPV for replication, immunizing against HBV prevents HDV. World Health Organization, 2023. Treatment options. Currently, there are limited options for hepatitis D. The most commonly prescribed medication for HDV is pegylated interferon alpha. Still, its efficiency is restricted and can cause significant side effects. Centers for Disease Control and Prevention, CDC 2024. Recap and further research needed. The most effective strategy to help prevent hepatitis D is to get vaccinated against hepatitis B, as HBV is necessary for HDV replication. WHO 2023. However, treatment options for hepatitis D are currently limited. CDC 2024. Therefore, focusing on hepatitis B vaccination remains crucial in preventing hepatitis D. At the same time, ongoing research is needed to improve treatment options. Hepatitis E. According to the Centers for Disease Control and Prevention 2024 and World Health Organization 2023. Transmission, fecal-oral route. hepatitis E virus, HEV, is transmitted primarily via fecal oral, often through contaminated water. Common symptoms. Symptoms of hepatitis E include jaundice, fatigue, vomiting, nausea, and abdominal pain, dark urine, loss of appetite, and pale stools. Key risk factors. HEV include ingestion of contaminated water, poor sanitation, consuming undercooked meat, and travel to regions with endemic HEV.
Hepatitis E, prevention and treatment, hygiene and sanitation. Preventing HEV involves maintaining good sanitation and hygiene practices, such as drinking purified water, washing hands with soap and water, and avoiding the consumption of undercooked meats. Centers for Disease Control and Prevention 2023. No vaccine in many countries. Currently, there is no vaccine for hepatitis E in many countries, including the United States. CDC 2023. Treatment options. There is no specific treatment for hepatitis E. Most cases resolve independently with supportive care, such as proper nutrition, rest, and hydration. In adverse cases, antiviral medications such as ribavirin may be prescribed. Kumar 2024. Chronic hepatitis. Acute hepatitis. Liver inflammation flares up suddenly and goes away because it is short term. John Hopkins Medicine 2024b. Chronic hepatitis. Long-term liver inflammation can produce progressive liver damage. John Hopkins Medicine 2024b. Complications: cirrhosis, liver cancer, liver failure and damage, and jaundice. John Hopkins Medicine 2022a. Long-term management: antiviral medications, regular monitoring, routine screenings, lifestyle modifications, vaccinations for HAV and HBV, liver transplant, and patient education. Johns Hopkins Medicine 2024a. Diagnosis of hepatitis. For your information, this was obtained from Johns Hopkins Medicine 2024. Blood tests, antibodies indicates past or ongoing infection. Antigens confirm active infection. Viral load measures virus quantity to gauge infection safety. Liver function tests evaluates liver performance and identifies damage via enzyme levels, bilirubin, which is bile pigment, and proteins. Imaging studies. CT scans detect liver abnormalities. MRI provide detailed liver images for assessing tumors. Ultrasounds are used to identify liver cysts and enlargement. Upper endoscopy examines digestive tract for complications. The biopsy analyzes liver tissue to assess damage and fibrosis. Public health strategies for hepatitis. Screening programs. Routine screening and diagnosis. Implement routine screening and early diagnosis of hepatitis B and C, particularly in high-risk populations. Access to medications and monitoring. Expand access to antiviral medications and strengthen monitoring systems to track hepatitis incidence and vaccination coverage. World Health Organization 2016. Awareness campaigns, public education, launch campaigns to raise awareness about hepatitis prevention, treatment, and the importance of vaccination. Global initiatives. Vaccination programs increase hepatitis A and B vaccination rates to prevent new infections. Safe medical practices to ensure safe medical procedures by promoting proper sterilization techniques and secure blood transfusions. Harm reduction programs support initiatives like opioid replacement therapy and needle exchange programs to reduce transmission among drug users. World Health Organization 2016. The conclusion, it's a summary of the key points. Hepatitis is liver inflammation caused by viruses A, B, C, D, and E. It affects vital liver functions such as metabolism, detoxification, and immune response. Types of hepatitis: A, spreads through contaminated food, water, and usually self limiting. B, transmitted via bodily fluids, can be acute or chronic. Bloodborne, which is type C, often leads to chronic infection. D, requires hepatitis B for replication. Hepatitis E, spread through contaminated water, usually self limiting. The key actions are for prevention focus on vaccination, hygiene, and safe practices. For early detection, crucial for avoiding chronic liver disease and treatment. Personalized therapy enhances outcomes and manages outbreaks. Hepatitis remains a critical public health concern due to its potential for severe liver damage, chronic illness, and widespread transmission, underscoring the urgent need for comprehensive prevention, early detection, and effective treatment strategies to safeguard global health.
Thank you so much for our student speakers. You've done a wonderful job putting this presentation together and speaking on those very important topics around hepatitis and the different types. Now we're going to move into the questions. This is our student discussion. So I'm going to read the questions and the brief answer to it, but then we're going to go ahead and put the students on the screen and give our perspectives, our insights, our knowledge. So, question number one: what are the long term consequences of having chronic B and C hepatitis? Acute or subacute hepatic necrosis, liver failure, cirrhosis, hepatic encephalopathy, and hepatocellular cancer in individuals with HBV or HCV infection are among the complications of viral hepatitis. How do hepatitis B and hepatitis D viruses relate and affect each other? This is our second question. Since hepatitis D needs the hepatitis B virus to multiply, it can only arise in people who have already contracted hepatitis B. I'm going to go ahead and highlight the students on the screen so we can give this some thoughtful discussion. Okay, so there we go. Um, Jaime, would you like to give your insights on this, my dear? And you're on mute. No worries.
I'm sorry. Question two?
One and two, and what if you have any personal experiences you want to share or insights. It's just kind of elaborating on these questions so the viewers can get more information from us as public health professionals as well.
So, what I did get from Hep D is that it's basically impossible to get D without having B first, right? Or being infected with B in the first case. So that's what I got out of hepatitis B. I have contracted hepatitis from eating shellfish in New York. New York City, one time it was mussels, and I went to the doctor about 1 month later, and I was positive for, I think, A, the food version. So that is my experience with hep.
Thank you for sharing. I used to love mussels, so that blows me under the water because I am more so on the vegan side than not, but sometimes I've been tempted to order them, and then I just think there's so many contaminants in the ocean, and so that's definitely insightful, scary, and something I learned from you today. Thank you for sharing. That all of us, I'm sure, learned. Um, Let's see. So I have Dr. Sana. Did you want to give your insights, my dear? Hi. And you're on mute too. It happens.
I'm sorry. Okay, I'm sorry about that. Yeah, so um, it's a very interesting topic and a very common medical condition. So as because I went to medical school in Pakistan, so over there I worked in. Um, before you get into medical school, you're required to get the hepatitis B vaccination. And of course, there is no vaccination for hepatitis C, but there are some precautions that um, we are required to take into consideration being a medical professional. So, and I get to work in a special hepatic unit during one of my rotations. And what was really scary was that how often a needle injury can result in hepatitis C infection. So that we need to be mindful of that, even not just the doctors or the nursing, even like if you're helping someone, one of your loved one, and you're handling that needle, you have to be extra careful. And that's one of the common reason for hepatitis C infection spread, and hepatitis B. So yeah, so one of my scary moment was that after my rotation finished, I checked for hepatitis C for myself because we were taking care of those patients who were severely ill with hepatitis B, C, or the combination of both. So that was really scary moment for me. But of course, needle injury is something to be always mindful of, because that's the most common reason for its spread after sexual contact.
Thank you for sharing that. Yes, so many just insights here, hearing from our students and being able to spotlight you guys. So thank you for your contribution, Dr. Sana and Jamie. Tamira, you have got to have something to say.
But yeah, I work in the OR at the hospital, so I definitely have to be careful because I'm dealing with instruments that's been full of blood and bodily fluid, and kids can have hepatitis uh, or HIV, whatever they have. And if I mishandle it or don't have on gloves, then I can catch it if I have scratches on my hands. So you have to properly wash your hands going in the room, coming out the room, Germex, and wearing your gloves, wearing the proper gear, just fully covered to make sure you don't catch anything, because you can't catch it just like that when not even thinking twice of, oh, I forgot to put my gloves on, but I'll be okay. And then you touching a patient or anything and you have a cut on your hand, and right then and there you gotta get tested, because it's been plenty of times where my coworkers, they would touch the needles and you have to close it up to put it in a sharp bend, but once you end up getting poked. So once you get poked, then you have to go get tested, and it's just a big old mess and protocol that you have to go through to make sure you don't have it. So yes, it is a big deal when you're dealing with needles or sharp objects where I work at. So
Thank you for sharing. Yeah, and I always not a big fan of going out and getting my nails done, but I do go and get my nails done when I have special occasions, and I always just get nervous when they accidentally cut you, or the last incident, the nail tech literally ripped my thumbnail off and it was bleeding. Like I know, Jamie, your eyes are like, I was just like, how are you gonna fix that? And he's like, oh no, I fix. And he just put another nail on top of it. But yeah, it hurt. And in my mind, I'm like, am I gonna get a disease from this, or hepatitis? I mean, there's just so many opportunities with and learning on this discussion, sanitation, going out to eat at a restaurant. And it's just everything is just so you have to be cautionary. And so, Pauline, I see your beautiful face here. I'd love to spotlight you and see what you have to say.
Thank you. I feel like this was a really good topic to talk about, and I'm glad joined the discussion because I feel like even though hepatitis is very common, it's not talked about enough, and like different ways to help prevent contracting it. I personally haven't had any experience contracting hepatitis, but just knowing like all the things that you can get from it is really good to know about. I also noticed that like the long term effects of having hepatitis B, it has to do more with like your liver, and hepatitis C has to do more with your heart and also your lungs. So I learned a lot just from this presentation.
Thank you for sharing that, Pauline. Great, great insight. Yes, and lots of learning. Elizabeth, I'm sure you have something to add, my dear.
I feel like if there were more education, there would be less cases of hepatitis and more opportunities. And I feel like if there were more opportunities for sanitized materials, there would also be less cases of hepatitis.
Thank you. And I feel like you were so concise in what you wanted to say about this and very direct. So thank you for adding that. And you are absolutely correct. Um, Last but not least, I covered everybody here. Crystal, and she can call me out if I missed anybody. I don't think I did.
No. Um, I have a few thoughts. The first thing that I want to say is I feel bad for anybody who gets hepatitis, but my heart really goes out to those who have B and D, because if you have B, you're going to have D because it's multiplying. Um, Elizabeth and I come from a very long line of family members on my mother and my father's side, and also her father's side of the family that drink. So that this is not anything, too surprising. However, I, did learn quite a bit about all of the hepatitis. I personally have never had hepatitis, but I've put myself in some risky situations in terms of I had body piercings. I'm now older. I'm not about the body piercings anymore. I have 7 holes in my ears, so you've got to be careful with ear piercing because they bleed. And I also went on the risky side and I have 2 tattoos. And you don't, just because the place can be clean, does not mean that the person working on you doing your tattoo doesn't have hepatitis. And that's all it takes is, their blood to mix them with yours. And it's really scary because hepatitis C you can get from blood transfusions. However, the one thing that this presentation did not cover is now they are required to test every blood donor for hepatitis and HIV and, sexually transmitted diseases, all of that. And so we're very lucky because 30 years ago, that blood wasn't tested for that. And I know there are several people in the world who have gotten blood transfusions, and one of them was a little boy named Ryan White, and he actually died because he received hepatitis through a blood transfusion. At least I believe it was hepatitis. So we've come a long way in medical research, and I'm very glad that now blood definitely has to be tested. So thank you for allowing me to share my thoughts.
Thank you for sharing. And so we will go ahead and maximize the questions again. And we're going to go on to the second set of questions. Question number 3: which locations are most affected by hepatitis and how common is it worldwide? As of 2022, 244 million people have chronic hepatitis B, mainly in Asia, Africa, South America, and the Caribbean. That is information sourced from the World Health Organization 2024b. Hepatitis C affects 50 million people with the highest rates in the Eastern Mediterranean. World Health Organization 2024 C. Hepatitis E and D are prevalent in low income regions, especially Asia, Africa, and Latin America. LQBAL 2023 and Miano 2019. Question number 4. What types of hepatitis have current treatment options? Treatments for hepatitis include antivirals like entecavir and tenofovir. For hepatitis B, through full recovery is rare. Over 90% of hepatitis C cases are curable with direct acting antivirals, DAAs. Hepatitis D has limited treatment options, with pegylated interferon being potentially beneficial in some cases. That is sourced by the World Health Organization 2024. I'm going to go ahead and zero in on our students again. And Jaime, would you like to add your insights once again on the second part here?
Yes, Cynthia. So concerning question 3, I saw that they mentioned the Caribbean, and I honestly believe that the prevalence of any hepatitis strain is probably worse than what they think or the numbers that they have, because that's not something that's very talked about in the Caribbean. They mostly talk about HIV and AIDS and diabetes, like the more chronic ones, but they don't. I hardly ever hear anything about hep.
Thank you for that. Dr. Sana.
Hi. Yeah. So, what is striking is that the numbers are so it's so prevalent, and yet the basic knowledge about it is still very low among the low income countries, the developing countries where it's more prevalent. And I would support what you said, because it's not many people are aware that if you can what are the common modes of spread of hepatitis, what are different types, and how important it is to get tested sooner than later, because hepatitis B and C can easily go into chronic infection and result in cirrhosis or hepatic carcinoma, which are not curable and not treatable. So that's why it's very important to raise awareness on it, and also make people aware of the different type of treatments and vaccinations which are available, only if it is pursued on a right time.
Thank you so much. And let's see here. I have Pauline. Did you want to share?
Yeah, I kind of want to agree with what Jamie said and how hepatitis isn't talked about enough. She also mentioned the Caribbean. I also feel like because it's not talked about enough, it affects the numbers because there's not enough awareness about hepatitis, which is also what Dr. Sana said. I do agree there needs to be more education or basic knowledge about hepatitis, what it is, how you can get it, or like different ways you can prevent yourself from contracting it. So I agree with what they both said.
Wonderful. Thank you so much for sharing that. Tamira.
I pretty much agree with what everybody's saying. The same thing, like with those countries and being not able to have money, or those pretty much that lack the resources. For instance, with water contamination, I feel like that's where most of those poor countries, their citizens are getting, hepatitis from, is the water, because you have animals using the bathroom in those waters, and they're drinking with feces in it, or trying to, have some way of hydration. So bringing awareness of also, thinking about the food they're eating and the water they're drinking, it could also help prevent hepatitis as well.
Wonderful. Thank you so much for sharing that. Elizabeth?
I feel like again, if there was more education, more people would know, and there would be more prevention of hepatitis. And if there were more treatment options, less people would also have it too.
Thank you so much, Elizabeth. Crystal?
Yes, I am going to agree with the entire panel, but I'm going to take a little bit of a different stance. We are very spoiled here in the United States, and our people can't afford health insurance. But the one thing that we could be offering globally, especially to low income countries such as Africa, where Jamie mentioned that they always talk about HIV and certain things, hepatitis is not talked about. If our spoiled country could just help make brochures with diagrams on basic things like hand washing and wearing gloves when you're at the hospital and not sharing needles and provide the knowledge that we had here. Some of these other countries would maybe cut down on the amount of infections being spread back and forth. And I think that then those lower income countries may be able to pick up some of the speed of where we are at. And for other diseases, they could continue that education to help bring some of those other prevalent diseases down. And so, my one wish before I die would be to see the United States offer the wealth of knowledge that we have to these lower income countries and help save a life somewhere else. Because we are supposed to join forces with the WHO and the CDC to help everyone not continue to create chaos because we can't afford to help other people. And we can, even if that doesn't mean that we can't afford to give them money, we can offer them the educational resources that we have here to help cut those numbers down. And it would make such a difference. So thank you for allowing me to share.
So insightful for all the different shares here, and once again, I don't think I missed anybody, and I'm sure Crystal would call me out if I did. She's wonderful at working with all of our students as our executive director of practicums. And we're very grateful for all the students on this call today: Elizabeth, Tamira, Jamie, Pauline, Dr. Sana, Crystal, of course. Thank you for your contributions today. So that will be a wrap and a success for our students working towards academic credit. So, Assuaged Foundation thanks you for joining our student team on the topic of types of hepatitis. You can follow us on social media at Assuaged app. We also have Assuaged Foundation. You'll find two pages for us out there. And of course, you can also visit our websites, assuaged.com and assuagedfoundation.org. Once again, thank you for joining us. Thank you to our students who contributed, and we will see you next time.